If your legs feel heavy by late afternoon, if your feet run cold even when the room is comfortable, or if you notice that standing up and walking takes a little longer to get going, you've probably tried to fix it the way most people do. You buy a supplement that promises better circulation, then another, then a bigger bottle with a longer label. And after weeks of taking it faithfully, you're still waiting for something to change. I understand that frustration. And I want to help you simplify this in a way that's realistic, responsible, and actually useful for everyday life. Today, I'm going to walk you through 3 specific nutrients that people most often use when they're trying to support blood flow to the legs. I'll explain the form that is typically chosen, the common dose ranges you'll see, and the safety points that matter, especially if you're over 50 and taking any prescriptions. And I'm going to give you one timing detail for the 3rd nutrient that many people overlook. It's not a gimmick. It's just a practical, fit-your-body's rhythm detail that can make your routine feel smoother. A quick, important note before we begin. I'm not diagnosing anything, and I'm not giving medical treatment. I'm sharing general education and common supplement practices so you can have a more informed conversation with your clinician. If you take prescription medication, especially for blood pressure, cholesterol, blood clotting, or blood sugar, please check with your clinician before changing supplements. That one step protects you. Now let's get into it. The first nutrient is vitamin B3, commonly called niacin. I think of it as the flow starter because when people use the right form, they often feel a noticeable change in warmth and surface circulation. But niacin is also the one that most people use incorrectly. Either they take the wrong form, or they take an amount that's too small to notice, or they start too aggressively and get uncomfortable. So let's make it clear and simple. When people talk about niacin for circulation, they're usually talking about the flushing form. The name you'll see on the bottle is nicotinic acid. That matters because there are also no-flush forms, and those are not the same experience. No-flush products can have a place in general nutrition, but if someone is specifically looking for that classic warming, widening sensation, the flushing form is typically what they choose. Now, about the flush itself. The flush is a temporary warmth, redness, and sometimes a prickly, itchy feeling. It often shows up on the face, neck, or upper chest, and it usually passes within 15 to 30 minutes. For some people, it's mild. For others, it can feel intense the first few times. Here's what I recommend from a common-sense perspective. Treat niacin like a strong tool, not like a casual multivitamin. Start low, take it with food, and give your body time to adapt. A commonly used starting amount is 250 milligrams once per day, taken with a meal. Food often makes the flush easier to tolerate. Then, after about 2 weeks, if someone is tolerating it well and their clinician agrees it's appropriate, they may increase to 500 milligrams once per day. Now, I want to pause here and say something very important, because this is where responsible advice matters. Higher dose niacin can interact with medications, and it may not be appropriate for everyone. It can affect lab values, and in some people, it can be hard on the liver at high doses, especially if used without supervision. So if you have liver concerns, if you have diabetes, or if you take prescription support for cholesterol or blood pressure, please talk to your clinician before you use niacin at these levels. It's not fear. It's just the right way to do it. And one more practical note. The flush often becomes less dramatic with consistent use. Many people find the first week is the most noticeable, and then their body calms down. So what is niacin actually doing in the circulation conversation? In simple terms, it's often described as supporting vasodilation, which is the relaxing and widening of blood vessels. Wider vessels can mean smoother flow, particularly to the extremities. People who notice cold hands and feet sometimes describe a subtle warmth returning more often. Niacin is also discussed in relation to blood lipid patterns, which is a separate topic, but it's one reason niacin has been studied and talked about for decades. So that's nutrient number 1. Niacin as nicotinic acid, the flushing form, used carefully, started slowly, and checked with your clinician if you have any medication or medical complexity. Now let's move to nutrient number 2, because even if vessels can relax, you also want them to stay resilient over time. Nutrient number 2 is vitamin K2, specifically the MK7 form. I call this one the flexibility helper, and I want you to picture a simple image. Think about a new garden hose. It's flexible. It bends easily. It handles changes in pressure without much trouble. Now think about an old hose that has sat in the sun for years. It gets stiff. It doesn't bend the same way. It doesn't respond as quickly. Our blood vessels are living tissue, and as the years go by, the goal is to support that tissue in staying responsive and elastic. Vitamin K2 is often discussed in wellness education as a nutrient that helps the body manage calcium placement. Many people have heard the idea that you want calcium in bones and teeth, and you don't want calcium building up where it doesn't belong. K2 is part of that conversation. Now, here's the detail that matters most. K1 and K2 are different. K1 is abundant in leafy greens and is associated with normal clotting function. K2 is the one people usually mean when they talk about long-term tissue targeting and calcium management. And within K2, MK7 is commonly chosen because it stays active in the body longer than some other forms, which means steady support across the day. When you look at dosing, you'll notice something right away. The amounts are small, measured in micrograms, not milligrams. A common supplemental range is 100 to 300 micrograms per day of vitamin K2 as MK7. And I want you to be very careful reading labels because micrograms and milligrams are easy to confuse. If you're ever unsure, pause and double-check. K2 is fat-soluble, so it's usually taken with a meal that includes some fat, even something simple like eggs, yogurt, olive oil, or fish. Now, the most important safety point for vitamin K2 is this. If you take prescription blood thinners, you must speak to the clinician who manages that medication before you start K2. This isn't a maybe. This is a firm rule. Vitamin K is connected to clotting pathways, and even if K2 is discussed differently than K1, you don't want to guess. You want professional guidance and consistency. Assuming it's appropriate for you, K2 is often used as a long-term, steady nutrient. It's not usually something people feel immediately. It's more like supporting the environment of the vessel wall over time. So that's number 2. Vitamin K2 MK7, 100 to 300 micrograms daily with food, and professional guidance if you're on anticoagulants. Now we get to nutrient number 3, which is very common, very accessible, and often underestimated. Nutrient number 3 is vitamin C. Most people think of vitamin C for immune support. That's fine. But vitamin C is also discussed for blood vessel health because it supports collagen. And collagen is one of the structural building materials used throughout the body, including in and around blood vessels. Vitamin C is also often mentioned in the context of the endothelium, the inner lining of blood vessels. That lining is not just a passive surface. It helps regulate how vessels respond to daily demands. And one of the key signaling molecules people talk about in this area is nitric oxide. Nitric oxide is a natural relaxation signal used by the body. When nitric oxide signaling is supported, vessels tend to respond more smoothly. Vitamin C is often described as supporting nitric oxide availability by helping maintain the environment where that signaling works well. Now, form matters with vitamin C, mostly because of comfort and absorption. Regular ascorbic acid is the classic form. Many people do well with it. But at higher doses, some people get stomach irritation or acidity. If that's you, consider a buffered vitamin C, which is mixed with minerals to make it gentler, or a liposomal vitamin C, which is packaged in a way that can be easier on digestion for some people. Now dosing. A common circulation support style dose range is 1,000 milligrams once or twice per day. That's 1 gram. Some people take 1 gram with breakfast and 1 gram with lunch. And now here is the timing detail I promised you. If you're taking higher dose vitamin C, many people do better when they take it earlier in the day, not late in the evening. Why? First, some people feel a mild energizing effect from vitamin C at higher doses. Not everyone, but enough people that it's worth mentioning. If you take it late, it can interfere with sleep quality. And sleep is one of those quiet, powerful foundations for how your whole system functions, including circulation and recovery. Second, it simply matches your daily demand. During the day, you're upright. You're moving. You're asking your legs to work. So taking vitamin C in the morning and early afternoon lines up the support with the hours you're actually using your system the most. So if you take vitamin C twice per day, consider 1 dose with breakfast and the second with lunch or mid-afternoon. Many people choose to avoid it later in the day. That's nutrient number 3. Vitamin C, ideally buffered or liposomal if your stomach is sensitive, typically around 1,000 milligrams once or twice daily, earlier in the day. Now let's step back and talk about what people get wrong, because this is where supplement routines fail. The most common mistake is relying on a standard multivitamin and expecting a targeted effect. Multivitamins are designed to cover basic needs and help prevent deficiencies. That's useful, but it's not the same as using focused doses for a specific goal. For example, a multivitamin might contain a small amount of B3. It may contain vitamin K, often as K1, not K2, MK7. And it may contain a modest amount of vitamin C. So people say, I'm already taking these, but they're not taking the form or the amount typically used in a circulation support routine. And the second common mistake is changing too many things at once. When you start 3 supplements on the same day, you won't know what helped, what didn't, or what bothered your stomach. A calmer strategy is to introduce them one at a time. Give each new addition about a week before adding the next. That way you can listen to your body and adjust responsibly. Now let's talk about practical expectations, because I don't want you chasing fantasies. I want you tracking reality. In the first week, if you use flushing niacin, you'll likely notice the flush. Some people also notice temporary warmth in hands and feet. Your main job in week 1 is to find a dose you tolerate and to make sure your clinician is comfortable with your plan. Between weeks 2 and 6, if the routine is a good fit, some people report that their legs feel less heavy later in the day, or that their feet feel warmer more often, or that walking feels a bit smoother. These are subtle changes, but they matter. After a few months, if you're taking K2 consistently and your overall lifestyle supports circulation, many people feel more steady overall. Again, not dramatic in a single day, but meaningful over time. And I want to add a piece that no supplement can replace. If you want better leg circulation, you have to use your calf muscles. The calf is sometimes called a second pump for the legs. When you walk, when you rise onto your toes, when you flex and extend your ankles, you're helping move blood and fluid. So here are 3 gentle habits that pair well with any supplement plan. First, walk after meals when you can, even 10 minutes, not fast, just consistent. Second, do a simple ankle routine once or twice per day. Point your toes, flex them back, make circles. If you're sitting a lot, do it while seated. It takes 2 minutes and it makes a difference. Third, avoid long frozen periods of sitting. If you watch TV for an hour, stand up halfway through and do 20 slow calf raises holding the back of a chair. These habits are not flashy, but they work with your biology. Now let me summarize your 3-nutrient plan clearly in one place. Number 1, niacin, vitamin B3, typically as nicotinic acid, the flushing form. Common starting amount is 250 milligrams once daily with food, with some people moving to 500 milligrams if tolerated and approved. It can cause a flush. It can interact with medications, and it's smart to involve your clinician, especially if you have liver concerns or take prescriptions related to cholesterol, blood pressure, or blood sugar. Number 2, vitamin K2 as MK7. Common range is 100 to 300 micrograms daily, taken with a meal that contains fat. If you take prescription blood thinners, you must speak to your clinician before using it. Number 3, vitamin C, buffered or liposomal if needed for comfort. Common dose is about 1,000 milligrams once or twice daily. Many people do best taking it in the morning and early afternoon rather than late in the day. Now, if you're the kind of person who likes a simple routine, here is one way people structure it. Breakfast, vitamin C and K2 with breakfast if the meal has some fat. Lunch or mid-afternoon, a second vitamin C dose if you're taking 2. Dinner, niacin with dinner, because taking it with a meal can make it easier to tolerate. Some people prefer it earlier, some later, but many like it with a substantial meal, so the flush feels more manageable. And once again, the safest approach is to introduce these one at a time and check with your clinician if you have prescriptions or complex health history. Finally, I want to give you a mindset that keeps you from wasting money. Don't judge a circulation plan by marketing. Judge it by signals. Are your feet warmer more often? Do your legs feel less heavy at the end of the day? Do you recover faster after walking? Do you feel steadier when you get up and move? Those are the real markers, not the size of the bottle, not the promises. If you want to commit to this in a realistic way, give yourself 90 days of steady use, combined with light daily movement. Track 2 or 3 simple notes in a notebook once per week. And keep your clinician in the loop if you take any medication that could interact. You don't need dozens of pills. You need a focused plan, taken consistently, matched to your body, and supported by small daily habits that help blood flow do what it was designed to do. That's how you build trust with your own body again. And that's how you give your legs the support they've been asking for.